My hello. My hello and good evening to all of you. Try to imbibe the concept fast, and you can watch this video again later. Okay. So good evening, all of you. Let's start. So far, 46 questions have been asked in INICET Psychiatry in the last 6 exams. The first INICET had 10 questions and the last INICET May 2023 had 9 questions. So considering that psychiatry is a short subject for INICET may be a myth sometime, because sometime the questions are more. And November had 2 sessions, 6 plus 6, that was 12. Otherwise 5 to 6 questions. So while analyzing, I just took a session on eMedicoz app called INICET PYT. All the DAM students who are having a current active subscription of any course of DAMS, I suggest you to go to INICET PYT session where I have discussed the 46 question asked from these 7 topics. Psychopharmacology is the number 1 topic in psychiatry from where questions have been asked. De-addiction is the number 2, 9 out of 46. So 13 plus 9 is 22. That means 50% questions come from de-addiction and pharma only. Remaining are these topics. So what I'm trying is, some of you have already attended PYT, in which in 1 hour I discussed 254 points approximately. So I will not go into that. Today what I have brought is, today I have brought 15 important MCQs and topics to be discussed, pinpointed to be solved in next 45 minutes. Are you ready? Are you ready? We'll go as fast as possible. So the question will be shown. You are supposed to mark A, B, C, D. All of you please attempt A, B, C, D. INICET focused 15 questions of psychiatry. Are you ready? A quick and a rapid fast revision of psychiatry for you. First question. Which of the following suggests psychotic rather than organic disorder? Do you know disorders in psychiatry can be functional, can be organic? Very, very basic idea. No. The cause is present in organic, absent in functional. The hallucination are visual and auditory. Sensorium may be impaired, normal, but lack of insight is a differentiation between psychosis and neurosis, and both of them are functional. Understand, it's a googly question. Insight absent in psychosis, insight present in neurosis. Both of them are functional. Why most of you are answering D? D is a wrong answer. Lack of insight differentiates psychosis from neurosis, does not differentiate psychosis from organic. A psychosis itself can be organic psychosis, that is delirium, and functional psychosis, that is schizophrenia. The question is difference between a functional psychosis versus an organic disorder. It is not insight, because insight would be absent in both. Understand, lack of insight is difference between psychosis and neurosis. The question is not psychosis and neurosis. The question is psychosis, functional psychosis versus organic. Come on. At least somebody has answered correctly. Complex delusion. Have a look. Functional psychosis, consciousness is intact, or organic psychosis, consciousness may be impaired. We are talking about delirium. Here there is no confusion. Here there is confusion. Insight is absent in both, but we have fleeting delusions in organic and we have complex delusions in functional psychosis. First question, most of you have answered incorrect. It was a simple basic question. You didn't read the question properly. If they ask psychosis versus neurosis, then your answer was D. But they didn't ask psychosis versus neurosis. They asked psychosis versus organic. All other 3 points, confusion and impaired consciousness, were more towards organic. Complex delusion was more towards functional, and lack of insight is a common feature between organic psychosis and functional. Is this concept clear? The first concept for you for the day. I have purposely pinpointed those areas which are gray areas. These questions you mark wrong. Why would I pick up this question? Just to tell you that you are marking wrong? No, I don't want you to commit the same mistake in the exam if it gets repeated. Okay? The most famous question is this one. Example is schizo, depression. Example is dementia, delirium. Organic means dementia, delirium. Functional means schizo, depression. Is that clear? Is this funda clear? All right. Try the next question. A patient with schizophrenia has delusion of persecution, thought broadcast, pseudo hallucination, and neologism. Which of the following is a disorder of possession of thought? Is it the delusion? Delusion is a disorder of content. Pseudo hallucination is not a thought disorder. Neologism is a disorder of form. Come on, quick. In every class, whether it is a regular batch, TND batch, DVT, AIIMS capsule, INICET, PYT, any predictor series, did you notice the students who are in DAMS that I tell this is a very high yield slide, this is a very high yield slide? Don't you know that this slide is there in the notes of all of you? Those who are DAMS students, form of thought, content of thought, position of thought, stream of thought. Did I make you revise this sometime in the class? See, if I have a 1 hour session, then also I put one question on this slide. If I have a 20 hours, then also I put one question on this slide because I feel this is important slide. Does this slide look familiar to anyone? Form, content, position, stream, regular batch, TND batch, DVT. Every time I give this slide. Insertion, withdrawal, broadcast. Does anyone remember that? Loss of association, derailment, form of thought, delusion, obsession, content of thought, thought insertion, withdrawal, broadcast, position of thought, flight of ideas, slowing of thinking, perseveration, thought block, stream of thought. I could have taken YouTube session live from home, but I came all the way to DAM's office just to, give you a better presentation from this chroma background, whatever they call it. So I wanted to give you a better visualization of the things, because when I take it from home I am unable to do this. Obsession is content. Come on. Come on, read the question. Ramesh is a model patient in the ward. He is never in any trouble. Whenever he is told to do, he sits. Obedient. He sits quietly for hours, rarely talking, hardly moving. Sits quietly for hours. Mutism plus akinesia. Hardly moving. except to ape the movements of those who pass by him. Ecopraxia. What are we talking about? What are we talking about? Catatonia. The key features. If it is delusion and hallucination, you will mark paranoid. If it is negative symptom, you will mark simple. If it is motor symptoms, you will mark catatonic. And if it is disorganized speech or disorganized behavior, you will mark disorganized. This is the first disease, schizophrenia, where they will ask you how to do subtyping. They will ask you prognostic factors, or they will ask you treatment. If a question comes on schizophrenia in INICET, it will be either this or this or this. On 5th November, when the exam will happen, and if the question comes on schizophrenia, I will tell you that I told you in the INICET predictor, either subtyping or prognostic factors or treatment. Something will come. Schizophrenia, first disease, you are supposed to know subtyping, prognostic factor, treatment. Second VIP topic, predictor series. Extra pyramidal side effect. Either they ask dystonia, or they ask akathisia, or they ask pseudo Parkinson. Do you know how many times dystonia has been asked in AIIMS? 3 times. Patient is given flufenazine depot injection, uprolling of eye, head and neck twisted towards one side. Do you know promethazine to be given oral or IV? Oral or IV? Oral or IV? Intravenous promethazine. Are you aware about this question? 3 times repeated. Oculogyric crisis, uprolling eyeball. I am just selecting the most frequently asked topics. For you, it is a 45-minute session. To prepare this, I spent 5 hours. What to tell, what not to tell. What to deliver, what not to deliver. Because there are some students who are not damn students and attending this session. I want this to be useful for everyone who is attending me on YouTube today. Promethazine. Can dystonia be lethal? Yes. If it causes laryngeal spasm. So your injection promethazine, injection Finargan is an emergency life-saving drug. Dystonia is more common in young males, more common in hypotensive medicine like risperidone, haloperidol, more likely to cause dystonia. Will you read these 3? I cannot make questions on all of these. So I am making question on one and telling you other 2. I am making question on one and telling you other 2. I am making question on one and telling you other 2. Do you get it? In 4 questions, technically I have told you 12 potential topics. Do you get it? Do you get it? Trust me, if any questions come from today's session, I will be more happy than you. Akathisia propranolol. Yes, Sunanda Verma. Not a characteristic feature of atypical depression. Come on. Leaden paralysis. Reversal of vegetative symptom. Response to MAO inhibitor. Good. Obsessional symptom. No. Obsessional symptoms are not seen. Atypical depression, VIP topic. In depression, they are more likely to ask you atypical depression, psychotic depression, or seasonal depression. Can you note it down somewhere? Atypical depression, psychotic depression, and seasonal depression are more asked. With every question, I am predicting a few questions. Do you get me? Depression has low mood, more in morning. Atypical depression has low mood, more in evening. Will you remember this? Kindly remember this. The sixth important topic, antidepressant. Last INICET they asked metazapine. The current INICET they asked trazodone. Previously they have asked vilazodone. And a very very important drug here is bupropion. Easy fatigability, guilt, disturbed sleep, sexual dysfunction. It is the only antidepressant with no sexual side effect. In two years back in INICET, they asked least sexual side effect. That time answer was metazapine because bupropion was not in the option. Trazodone they asked priapism recently, and they asked which of these is a novel antidepressant, Spari. Do you know last INICET they asked new drug approved in Rett syndrome. So I thought you should be knowing new drug approved in depression. This drug has been approved in September. Is Gepiron. 5-HT1A partial agonist. Brother of buspirone. Bupropion lower seizure threshold. It is used in smoking cessation. But what is a better drug in smoking cessation? Varenicline is better. Varenicline has been asked 2 times. Dysthymia versus major depressive disorder versus adjustment disorder. Mark it. Famous clinical scenario asked in INICET. Dysthymia means low mood more than 2 years. Also known as come on, why are you answering this? 3 years. 3 years is Is the video okay now? Five out of nine criteria is met, major depressive disorder. 5 out of 9 criteria not met, adjustment disorder. Next important is postpartum psychiatric disorder. Blues, depression, psychosis. Low mood less than 2 weeks, blues. Low mood more than 2 weeks, depression. And low mood more than 2 weeks plus delusion against the newborn. What is the answer? Dysthymia is low mood more than 2 years. Cyclothymia is fluctuating mood more than 2 years. Shabnam Tehlan. Answer of 7 was neurotic depression. Neurotic depression is the other name of dysthymia. What is this one? How she might commit suicide. Suicide, more in postpartum depression. Infanticide, more in postpartum psychosis. A very basic simple question which some of you have marked wrong again. Postpartum blues, sadness, labile mood is the most common symptom, tearfulness, supportive, no treatment required. Postpartum depression, low mood more than 2 weeks plus guilt, anhedonia, suicide, antidepressant, rarely ECT. Depression plus delusion against the newborn, postpartum psychosis, chances of infanticide, mother to child separation, antidepressant plus antipsychotic. Next scenario, stress related disorders. Acute stress disorder versus PTSD and adjustment disorder. Very high yield and predictive clinical question. I am telling you a question might come on ASD versus PTSD. Again, so many of you are marking wrong. 3 weeks, less than 1 month. Acute stress, more than 1 month, PTSD. The symptoms are HIA, hyperarousal, intrusiveness, avoidance. HIA, hyperarousal, intrusiveness, avoidance. Emotional outburst, refuses to drive. Match the column. Expect 10 to 15. Match the column in INICET. Match the column in INICET has a different marking scheme. Are you people aware about the marking scheme? The catch is every option shall be evaluated individually. Bereavement is normal grief within first 2 months. Nikita Raj Gadia. Delirium on top of dementia is called backloaded dementia. Fluctuating cognitive impairment is Lewy body dementia. Rapidly progressing is CJD, and memory is affected late in frontotemporal dementia. Can you take a screenshot on this? Alzheimer's disease, slowly progressive. Vascular dementia. Yes, in names you will not have that permutation combination given of A, B, C and that. Emotional ability. Visual hallucination. This I am expecting. Backloaded dementia. Delirium on top of dementia. Are you taking a note of this? Among the 19 subjects of INICET, 7 of them are tough. And out of those 7, one of them is psychiatry. Do you know this? This was told to me by last year INICET topper. Among the 19 INICET subjects, 7 of them are very tough. We know PSM, pharmacology, but one of those 7 is psychiatry. Among short subject, the tough part in INICET is psychiatry. Do you know this? Do you know the level of psychiatry in INICET is one level above that in NEET? Little bit. So you have to know 1 or 2 extra points here and there. Very good. What is NPH? Normal pressure hydrocephalus. AD is Alzheimer's disease. Come on. Alcohol withdrawal. 3 times asked in INICET. 7 times asked in AIIMS. VIP topic. What's the first treatment? Complain of talking to self, irritability and irrelevant talk. Delirium tremens. Admit and administer the patient lorazepam with thiamine. All of you clear about this concept? For seizure, diazepam plus thiamine. For delirium, lorazepam with thiamine. First symptom, key symptom, most common symptom, tremors. Autonomic hyperactivity, 6 to 8 hours after the last drink, mild withdrawal. 8 to 12 hours, moderate withdrawal. Alcoholic paranoia, alcoholic hallucinosis. Then comes seizure and finally delirium tremens. Alcohol causes auditory hallucination in clear sensorium and visual hallucination in altered sensorium. Alcohol causes both auditory and visual. Auditory first, visual later. Auditory first, visual later. A very famous question. Very, very famous question. Yes, for these two we give chlordiazepoxide plus thiamine. On 10 RU. Narcolepsy. Amongst sleep disorders, very important, narcolepsy. Answer. Cataplexy is a pathognomonic sign. Hypnagogic hallucination are more than hypnopompic. Daytime sleep attack is the most common, and SOREM is seen on sleep studies. Why? Because in narcolepsy there is no REM latency. Because there is no REM latency, the sleep starts with REM. Because there is no REM latency, so sleep starts with REM. Gogic are more specific than pompic. Gogic are more specific than pompic. Sleep starts with REM. There are two types of hallucination in narcolepsy, hypnagogic and hypnopompic. Hypnagogic means while going to sleep. Hypnopompic means while waking up. Cataplexy, loss of tone on emotional events. All friends were cracking a joke, all were laughing, he was laughing. All were laughing, he was laughing. He laughed so much, roll on the floor laughing. ROF हिल हंसते हंसते गिर गए, हंस हंस के लोटपोट हो गए. Excessive daytime sleepiness. Hypnagogic. Hypnopompic. This is your normal sleep cycle. Check out NREM 1, 2, 3, 4. 3, 2 REM. In normal sleep cycle, it takes some time for REM to come. That is called REM latency. The time taken from sleep start to REM start is called REM latency. So REM comes a little after when you start sleeping. Suppose you start sleeping here, REM will come here. Okay, so there's a time called REM latency. Now have a look at narcolepsy. Sleep starts with REM. Do you see any NREM? No. Suppose they give you this graph in the exam. What is the polysomnographic finding in narcolepsy, or what is the sleep histogram finding? Answer is SOREM. Sleep onset REM. SOREM. 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 In normal sleep, it is 1, 2, 3, 4, 3, 2 REM. Normal sleep, it is 1, 2, 3, 4, 3, 2 REM. But in narcolepsy, REM. In narcolepsy, REM. In narcolepsy, REM. 3 times, huh? Ekta Kapoor. Read the question. A childhood friend makes a visit to your office. This might happen with you. The last time you saw her was at her wedding 1 year ago. So you know that she is married. As the conversation proceeds, you ask her casually if her married life is treating her well. First message to you: never ask your recently married friend how is your married life going, especially 1 year after marriage. Because within 6 months, the honeymoon period is over, and 1 year after marriage, if you ask anyone how is her married life going, his or her, it hurts. Remember, huh? Your friends non-medicos are getting married, and you meet them at a party and ask how is your married life going. Never ask this question. She suddenly burst into tears. Dekha, रुला दिया ना? And admits that her husband is physically abusive. She can't leave him because she is deeply afraid of being alone. Okay, the woman has her parents always make decisions for her, including those regarding education and career. Wow, ideal girl. Always been very pleasant, courteous in her dealing with others, avoids arguments or disagreement whenever possible. Dream girl यार, come on. लड़ती नहीं, झगड़ती नहीं, पेरेंट डिसीजन लेते हैं, वाह क्या बात है, unimaginable. So she can't take decisions of herself. Okay, avoids argument, disagreement. What is the personality we are talking about? Come on. Dependent. Schizoid or emotional coldness. Look, if it is a psychiatry session, one MCQ has to be like this, na? Otherwise, how will you feel that this is a psychiatry INICET predictor? You watch any subject INICET predictor, you'll not feel the same as you feel in psychiatry. So there should be some signature of my subject, na? In exam also, one MCQ, only one MCQ can make you smile and laugh, and that would be psychiatry. That will make your mood a little lighter. Schizotypal, odd beliefs, magical thinking, avoidant, introvert, shy. Borderline, emotionally unstable. A are the people who avoid, they are in their own world, schizoid. They live in their own fantasy, emotionally cold. They don't react. Schizotypal are the people with odd belief, power of the crystals to protect me, Hogwarts, Horcrux. All these are schizotypal. Avoidant, introvert, shy, dependent, So this tells you that personality disorder is a predicted question. Personality disorder is a predicted question. Psychology. Is this positive countertransference or negative countertransference? Come on. Positive counter transference. Dear Zindagi. Positive transference. Alia Bhatt. Shah Rukh Khan. The Return of Abhimanyu. Vishal and Samantha. An excellent Tamil movie. Samantha was a psychiatrist and had counter transference. Last question. Come on. Which of the following is a dose dependent side effect? Come on, quick. This is idiosyncratic. Valproate has three very famous side effects: pancreatitis, thrombocytopenia, hyperammonemia. Very, very famous side effects of valproate. We are asking dose dependent. NMS, it is also idiosyncratic. Sometimes NMS, neuroleptic malignant syndrome, happens on a very low dose. Very low dose. Agranulocytosis again is idiosyncratic. Clozapine agranulocytosis is idiosyncratic. Clozapine seizure is dose dependent side effect. Seizure is dose dependent. What is the answer? Hepatotoxicity due to naltrexone. Side effects of psychiatric drugs are more important than effects itself. Can you write it? VIP drugs. SSRI. Valproate, carbamazepine, lithium valproate carbamazepine. Drugs used in de-addiction. So the session ended well in time. I planned 45 minutes, 15 questions, and here I am, exactly at 45 minutes and 15 questions. These 15 questions have been handpicked by me. None of them is a PYQ. I intentionally didn't keep PYQ in today's session, so I tried to keep new questions based on the PYTs, based on the previous year topics. I hope the session was useful. My final words for you for INICET exam. May I? May I speak the final words? Best of luck for INICET. You need the most luck in this exam as compared to NEET exam, because there are certain odd topics that will come which is not studied by everyone. Every student studies some odd topics, some here and there things beyond the normal course. If your odd topics come in this INICET exam, your rank will shoot up. So you need luck. What everyone has studied should come. Tell to God, what I have only studied should come in the exam. And I give my luck also to you. I'm very lucky. May my luck be with you. Number 2, be mindful of attempting. This exam has more negative marking than others. All questions are not having same marking scheme. Lastly, it is achievable. If you go with the positive thing that it is achievable, if someone like me can get a 400 500 rank in AIIMS back in 2011 and 12, then you people are much smarter than me and you can score far better than me. Okay, I presume I only know psychiatry and you know 19 subjects. More than you can learn from me, I can learn from you. You people know a lot. Just believe it is possible. Trust me. Okay, somebody among you only is going to sit with me and other faculties here to give an interview after INICET. Are you the one? Hoping to see you here in the damn studio where we take interviews. Bye bye. Best of luck. Thank you.